The Ministry of Health is warning that stigmatization of COVID-19 patients, and especially those who have recovered, could be detrimental to those affected and a hindrance when it comes to the fight against COVID-19. The warning coming on a day that 497 cases were reported over the last 24 hours, a majority of them being in Nairobi County. With the trend seemingly appearing to pick up as days go by, the ministry is telling Kenyans to adhere to all measures put in place by the government to help contain the disease. Raquel Moigai reports.
Since the first COVID-19 case was reported in the country in March, Nairobi County has been steadily recording an increasing number of cases at an alarming rate. As of Monday, Nairobi was leading with 5,705 cases, Mombasa following with 1,739, Busia with only 550, and Kiambu with 520.
In the last 3 days alone, Nairobi has registered 518 cases, and this indeed is a worrying trend, and something must be done. It is important that the residents of Nairobi are alert and are able to act very quickly in terms of adhering to the containment measures.
The scenario quite evident in today's briefing, where Nairobi registered 292 cases, Kiambu 62, Kajiado 51, Machakos 30, Mombasa 28, Busia 10, Uasin Gishu 8, Nakuru 5, Makueni 3, Narok, Nyeri and Meru counties recording 2 cases each, with Kakamega, Kericho, Kilifi, Laikipia and Nandi recording only a case each.
Getting this disease is not a crime, and those who are infected with this disease are not criminals. Profiling them and elevating, stigma in the society. Again, this is something that does not add value to this fight of COVID-19 and ends up stigmatizing the situation and making it even harder for us to be able to maintain our containment measures, for us to be able to work together, adopting a whole of society approach in dealing with this disease.
But of utmost concern is the systemic COVID-19 infection. New evidence indicates that COVID-19 does not only affect the respiratory system, but also other body organs. This proving a challenge, especially to those who are placed under intensive care.
You find that these patients end up with multiple organ problems, leading to what we call multiple organ failure. So when the lungs begin to fail, in sympathy, the kidneys also slow down, the heart slows down. Notwithstanding the clotting problems that these people have, the cytokine storm, where your body, in trying to fight the infection, overdoes it and therefore puts the rest of the organs at risk.
While the ministry cites recoveries of patients admitted in the ICU are possible, there exists a set of challenges which pose a greater risk to those who are under ventilation.
That being an invasive procedure puts you at risk of getting secondary bacterial infection in the respiratory tract, which of course complicates your management.
Only 190 COVID-19 patients have ever been admitted in the intensive care unit since the virus marked its presence in the country, out of which 90 recovered, while another 73 succumbed. As it stands, only 36 patients are still admitted at various ICUs in different hospitals in the country. Raquel Moigai, Citizen TV.